Hello, and welcome to A Swift View on Health. My name is Scott Schoenvogel, and today we're going to evaluate one of the biggest questions out there in the news right now on the healthcare industry, and that is whether AI is going to help or to hurt healthcare. So let's dive in and cover a few of the key learnings that have come out recently in a Peterson Healthcare Technology Institute report. Okay, so AI and healthcare administration. Is AI going to help or is it going to hurt? So this entire question of where is AI going to really impact healthcare administration is a huge question right now. I'll be honest, at Swift, we've been really excited about the potential for AI to handle a lot of the broken communications and interactions across the healthcare industry. We have disconnected systems that are never going to really talk to one another, but an AI bot to an AI bot to do that communication might really work. We're super excited about the power for AI to impact scheduling. But where most of the major players in healthcare right now are deploying AI, it's really around the administration process. And what's happening in the administration of healthcare through the use of AI is that we're really increasing our ability to do certain transactions that the system somewhat struggles to manage volume around today. But AI is helping us submit authorizations, submit bills at rates that and at timelines, we've never really seen before. And when we have issues, with that process, we're now using AI to handle those issues, which means things like appeals. I think in one of our last sessions, we talked about how we were only appealing 12% of denials that were out there. Well, obviously with AI, that could go up dramatically. And what's the impact of all those new appeals? If you think about it, with one side is starting to, challenge or send more transactions, the other side is starting to kind of arm itself with, other AI to handle all those transactions or try their best to manage or reduce them. And so this is where we get into this concept called AI bot wars, where we've got providers versus payers, and each of them are kind of using AI for their own purposes. And those AIs are quote unquote, warring against one another. So we've got some serious concerns that we may be about to flood a system that's not super efficient as it is, with a whole new level of task and requests that, while those costs have gone down, the dramatic increase of volume may actually overwhelm and create more costs for us out there. So the way this works is that, we could get a lower cost per transaction or claim filed or appeal filed. But if we do a lot more of those and we do more at an increasing rate so that it exceeds, effectively our lower cost per transaction, overall, our system costs are going to increase. And it looks today like we can do so many more transactions through AI than we've ever been able to do before. And while the cost will go down, the cost will not go down enough to compensate for that increase in transaction volume. And, we need to understand that providers in particular have for a long time been relatively inefficient, just in terms of their ability to document care, to handle kind of the complexity of medical billing, to submit that care. And they're now starting to see an opportunity to use AI to dramatically increase kind of the completeness of their documentation, the intelligence of that documentation to try to identify additional revenue, And, as such, that work is starting to percolate through the system. And we're even within just like the first 6 to 12 months of a lot of these systems being in place, we're seeing pretty significant impacts on overall healthcare spend. Now, you could argue that this is maybe a good thing for providers that have always been, have deserved to be paid more. But on the flip side, like from a patient and an employer standpoint, like we really can't afford the healthcare that we're paying for right now. So if our healthcare costs continue to go up through additional documentation, it's going to make it really challenging. So once again, just in the last 6 to 12 months, a 5% increase in just the level of severity that's coming through on our visits, and just in terms of the highest level that we've been able to document through AI, and then just from a lower, one level lower visit, so level 4 versus a level 5, that's up 7%. But in general, it's $1,000 more per provider per month, another $12,000 a year. Multiply that by all the providers, and all of a sudden, we're talking about some significant increase in costs. And that's just, that singular dynamic actually has this kind of cascading effect where we've adopted AI, we've been able to increase our coding intensity and thus our payments, but that has raised our overall costs. Thus, we get to higher premiums necessary to cover those costs. And once again, we're back kind of at the employer and the patient level who's trying to fund a lot of those healthcare costs, and this just becomes even more unsustainable. So, this whole, bot versus bot arms race, particularly around this coding intensity, clearly if you are a payer, and providers are now submitting more and more claims with more and more intense care, you're going to put more AI controls on your side to try to keep your costs as close to their historical levels as possible to challenge a lot of that payer and provider complexity that's coming through in the documentation. I'm not exactly sure right now, other than looking at historical trends or looking for disclosures around when AI is being used, like the electronic health record or the medical record has historically been like the absolute source of truth for payment or reimbursement in the industry. To the extent that those records are now going to be generated through AI, which is anticipating, a lot of services that may or may not happen, like it's going to be very difficult to challenge that. And at the same time, it's going to be very difficult for those records to truly stay accurate against what's happening with patients in reality. And so it's just, once again, really important to understand that AI is speeding up the cycle. It's not breaking it, which means I can do more denials, I can appeal more, but I'm not necessarily eliminating the need for prior authorizations, eliminating the need for denials, or eliminating the need for appeals. So it's really just, we're kind of doing more of the things that we like the least, and that's not a direction where we want to take the industry. There is hope that AI, will actually make us more efficient with a lot of the processes that we don't like today. For example, what would be the purpose of a lot of authorizations if, the AI engines can immediately look in the electronic health record and instantly validate or give feedback back on, what's necessary for that patient to do next in order to be authorized. So can we avoid that whole back and forth process to begin with? Clearly using in the electronic health records and the practice management systems that are out there, to the extent AI can make sure that there's not missing information, that can help reduce hopefully some denials. But as we talked about before, the increasing pressure on both sides, there's likely going to be adoptions of new catches, new controls, new levels of documentation challenges that once again will just make more of what we're doing today, in a system that these really positive outputs aren't immediately available just because we've got massive variation in payer policy rules. I think I saw some statistics that, the 5,000 codes that are, of the four major payers that are consistently used in prior authorizations, only 3% are universal across all four payers. So just a tremendous amount of variability. Those systems are very fragmented. They have their own clinical data standards. There's so many different EHRs out there that they just can't connect to all of them. So once again, can that AI really have that impact? Probably not. And thus, in all likelihood, there's a lot to be concerned about. I think that AI is likely only going to continue to drive up these high healthcare cost trends, in ways that, because of higher claims, drive higher premiums, which then end up with higher out-of-pocket costs for patients. On top of this building kind of need to try to protect yourself by spending more and more on AI. That just becomes a vicious cycle and something that we need to figure out a way to prevent. And this is where, in order for AI really to do the things that we want it to do in healthcare, like identifying disease more efficiently, managing treatments and outcomes in a way that helps patients get healthy as quickly as possible. But on the administrative side, I think we're going to need more structural changes and not just more powerful engines to help us operate within the existing structure. So we talked about it a little bit before, but when we think about prior authorizations, let's do clinical reviews, but let's not make that a requirement for payment up front. Let's do those on the back end to help assess whether or not that provider is, has integrity and should be in our networks. And on the billing side, there's just a massive need to create more simplicity within the overall billing structure and really to create more accountability on providers to help manage an overall episode of care and the outcomes for that episode. And to the extent that your payment is based upon managing an overall episode of care, some which cost less, some which cost more, but on the whole, if you do that well so that they consistently cost less, you make more money, like that would be really positive for the industry itself. And then, once again, like to the extent that we can reduce administrative complexity, that will allow, significant dollars that are wasted on those processes today to hopefully flow back, either to the patient employer, as in the terms of lower premiums, higher salaries, but also just on the provider side, to the extent that I get back money, that I get back time, I'm able to use that to focus more on what's really important, true patient care. Okay. So thank you very much for listening today. We really appreciate your interest in trying to learn what's going on in the healthcare industry and how to make it better. We hope this episode of A Swift View on Health was valuable to you. And as always, stay cool, stay swift.